Hello, everyone, and welcome to Living Healthy and Aging Well. My name is Ken Hageland, and we are broadcasting from the AM 950 radio station that overlooks beautiful Bryant Lake Regional Park located in Eden Prairie, Minnesota. It is another gorgeous day in the Twin Cities, and I am so grateful to be here with you today, and I hope all of you listening are doing well. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to help you and your loved ones improve and enjoy your quality of life. I want to thank all of you that leave us messages on our radio show phone line. We appreciate hearing from you, and we welcome your comments, questions, and topics for your future shows. Also, if you are interested in being a guest on our radio show, please call or text us at 612-999-3426. You can also contact us on our website at livinghealthyradio.com. There you can find information about upcoming guests as well as listen to our previous shows. We look forward to hearing from you. We are adding new listeners to the show each week, not only here in the Twin Cities of Minnesota, but also throughout the country. You can find podcasts for all of our radio shows on the AM 950 radio website, and we can also be found on iTunes, Spotify, SoundCloud, and many other podcast and streaming services. You can also watch our broadcast live on the radio station's Facebook page at AM 950 Radio. We have another great show for you today. I'm very excited about this, and it's very timely. We have Jetta Wiedemeyer Bauer. She is the manager of the volunteer and community outreach team at Trellis, a nonprofit that has been serving seniors and those who care for them for 28 years. Jetta will be here talking about the senior linkage line services that they provide and ways to access free, unbiased Medicare health insurance counseling, education webinars on a variety of topics related to aging, the important role of volunteers in their work, and the current Medicare Advantage and Medicare enrollment period. Trellis has been an innovator and thought leader in the field of aging for 28 years and works to help people optimize well-being as they age. I am looking forward to my conversation today with Jetta. If you have any questions for Jetta, there are two ways to reach us. You can ask your question live on the air by calling AM 950 radio station, and our friendly show engineer, Patrick, will get your call on the air. That number is 952-946-6205. Or you can text us your question at 612-999-3426. Once again, call us for getting your questions on the air, 952-946-6205, or text us at 612-999-3426. Now, don't worry, if you miss those phone numbers, I will repeat them throughout the show. And also, please don't wait till the show's ended to call or text us your questions. We often receive many of the same questions after the show has ended. If you have a question, many others do as well. So please contact us. We are looking forward to answering your questions today. All right. I would like to introduce my guest for today's show. She is a great friend of the show. We appreciate her and her organization so much. Jetta Wiedemeyer Bauer. She is the manager of the volunteer and community outreach team at Trellis, a nonprofit that's been serving seniors and those who care for them for 28 years. Welcome to the show, Jetta.
Hey, thanks so much for having me.
We were talking earlier off the air how, you're one of the best kept secrets in the Twin Cities. I mean, you guys do such great work, and it's so important. And I'm so glad to have you back on the show. You've been here before, and people always are so grateful about your being here and all the information you share with them. And so it's great to have you. Right now is an important time of the year, and we'll get into that here shortly. But before we do, everyone that listens to the show loves to know about you. They like to know, who is this person on the radio? Why is this person on Ken's show? So before we start about this important topic, let's talk about you and just give us a brief background about your life and a little bit about how you ended up being inspired to work at Trellis.
Thank you so much. I'm excited to be here on this beautiful Saturday. I work in the nonprofit world. I've been in there for 10, 15 years, and I started in state government. I work for the legislature. I work for city government. But I started working for a nonprofit early in my career, and my heart was stolen. I
Mm.
loved working at nonprofits because it's an opportunity to impact people's lives and make positive changes. So I have worked with babies. I was executive director of the March of Dimes. I've
Oh,
worked in foster care and adoption, getting kids out of the system and into great homes. I was a national speaker and ran a national resource center. I worked in drug and alcohol treatment. I've worked the gamut of pieces from babies all the way through adults, and now I get the pleasure of working with seniors and older adults. And in my family, our motto is we are built to serve.
mm,
So, from the very early on, childhood memories of being volunteering and going in church opportunities in the community, I just love an opportunity to help my fellow man
mhm.
and woman and child. So, I live in South Minneapolis, been in the cities for a long time, and just that's where I call home. And husband, 2 kids, and just have an opportunity to have a wonderful life of service, but I get paid to do it,
Mm.
which is like awesome.
Well, and we've talked before on a previous show about true joy comes from serving others,
Yeah.
and until you reach that point in your life where you recognize, wow, when I'm serving others, I'm at my best,
Mhm.
and it's just the amount of reward that comes back to you. And
Mhm.
my organization, I've got just tremendous team of people that are out serving every day, taking care of end of life patients, and it really is such a blessing to have
Mhm.
I say the people that we're taking care of, and you're serving, that generation just is so grateful. They're
Mhm.
so thankful for any kind of help,
Yeah.
and it's very very hopeful for us.
It brings joy to people, and when
Yeah,
I see people enjoy, it makes me, happy,
yeah,
happy.
yeah. You're doing the right thing. You're in the right field. No, you
Thanks.
are. Um, well, we got a few minutes here left in the first segment. Tell us, what is Trellis, and then how does that relate to this amazing service called the Senior Linkage Line?
Yeah. Trellis is a nonprofit organization, and we exist to assist individuals to age successfully, but also to develop the capacity of communities to care for an aging population. Our vision is to serve 1 million people by 2023,
Wow.
and we want to help people optimize well-being as they age. So Trellis is an organization that has a program related to pension rights and helping people find lost pensions. We have a program related to Alzheimer's and dementia and memory care. We related to education. We
Mhm.
have evidence-based health programs called Juniper, where we do chronic pain programs and diabetes and stretch and movement, so that people, as they get older, they move and they feel better. They have better lives. So we do a lot of information in the organization, but the Senior Linkage Line is this close partner that we work with. The Senior Linkage Line, again, is a free statewide service of the Minnesota Board on Aging, and they work and partner with 6 area agencies on aging throughout throughout the state. And Trellis just happens to be the area agency on aging for the Twin Cities.
Wow.
Because of that designation, we work with Older Americans Act dollars. So the federal government gives it to the state of Minnesota, and then they give it to each of our organizations. Trellis was able to distribute over $13 million to the ground, right? We work through about 60, 65, 67 different organizations throughout the metro. These are organizations that are making incredible impact in people's lives. For instance, we have organizations that give rides for individuals who, for whatever reason, whether they've never driven, they don't currently because of medical or just life issues. We gave over 22,000 transportation rides to folks last year. And during the pandemic, that's kind of crazy, right? There's a lot of folks that have home delivered meals, and we have dollars that go to that. We delivered over 1 million meals last year. And in a world of
In
the pandemic,
in Minnesota,
in the Twin Cities,
Twin Cities.
in the
Oh, oh,
Twin
oh,
Cities,
just the
just our
one
Twin
here,
Cities,
not
right?
statewide.
Exactly, right. I mean, it's just
Wow.
the scope and the impact that the Senior Linkage Line has through our partners. And again, government provides the ability to fund it, and we, administer those dollars, but we give
Mhm,
them to our trusted partners on the ground because they know their community, they know
mhm.
what they need and what. But one of my favorite pieces is we do telephone reassurance calls, and that was kind of a great asset during the COVID pandemic world, they did 8,500 calls, and they might be just calling someone to say, "Hi, how you doing? I haven't talked to you for a little bit. Are you eating? Are you feeling good?" And when someone's trapped in their home, we all were there, right? But if you
Right.
don't have that ability to interact with someone, it really impacts. I was at a training a couple weeks ago. It was a statewide summit on dementia that Trellis had hosted for the state. And one of the speakers from AARP came on and said an individual who is isolated in their world for prolonged periods of time, their life expectancy is decreased by 15 years.
Oh, I've heard that same thing. No, it's shocking.
It's a mind blower,
Right,
right? And
right.
so, the senior linkage line through these older American Act dollars gives us an opportunity to interact with the people on the ground, like, the neighborhoods and communities. And it has an opportunity for us to just make a real good impact. So we value that relationship with the senior linkage line. And as you said earlier, it is a great kept secret. And we are trying to blow the lid off that one, baby, because
Well,
people need to know that these are free and anyone can tap into them.
yeah, and every time I talk to you, I learn something new, and so I'm really fascinated for the rest of the show here to see what else I'm going to learn as we talk about more of this. This is great. All right, it's time for a short break, folks. We'll be right back to continue our conversation with Jetta Wiedemeyer Bauer. She is the manager of the volunteer and community outreach team at Trellis, a nonprofit that has been serving seniors and those who care for them for 28 years. If you have a question for us, please give us a call, 952-946-6205, or you can text us at 612-999-3426. I'm Ken Haglund, and you are listening to Living Healthy and Aging Well.
Is getting to sleep adding to your life's anxiety? Do you struggle with falling asleep or staying asleep? We can help. I'm Dr. Inel Rosario of Andros ENT and Sleep Center, and my team of sleep specialists can help you discover the joys of continuous sleep. Call 651-888-7800 to schedule your insomnia consultation today. You can also find us at androsent-sleep.com. That's androsent-sleep.com.
The Senior Linkage Line is a free statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
Now, more than ever, we are being faced daily with the topic of human mortality, and for many people, estate planning has been top of mind. Getting your estate planning done now can be easy and cost-effective. Schroman Law offers virtual options for initial consultations so that new clients can safely initiate the process. With many facing uncertain financial situations, Schroman Law also offers affordable fees for legal documents. Learn more at schromanlaw.com. That's SCHROMEN law.com.
SeniorCommunities.guide is your free online website to find housing, care, and resources for seniors in Minnesota. Use the powerful, award-winning search tool to quickly improve your search. You will have all the information you need to contact providers directly without any hassle. Start your search now at SeniorCommunities.guide and follow us on Facebook for interesting articles, helpful advice, and how older adults are changing the world.
SeniorCommunities.guide.
I'm John Peterson of Ferndale Market, and I'm the third generation to grow turkeys on our family farm in Cannon Falls. We've grown them the same way since 1939, free range and without antibiotics. We're proud of the way our turkey tastes naturally, so we never add fillers or basting solutions, just 100% pure turkey. And we're proud to remain an independent family farm. Looking for an extra special addition to this year's Thanksgiving feast? Our fresh, never frozen turkeys remove the hassle of thawing and can be picked up just days before your celebration. Available at natural food stores across the region. Reserve your fresh, free-range Thanksgiving turkey for pickup at our store right on our farm in scenic Cannon Falls or at one of our retail partners. For more information on finding our Ferndale Market Thanksgiving turkey near you, visit us at ferndalemarket.com. That's ferndalemarket.com. Thank you for your support of local foods and farmers. We'll hope to see you at Ferndale Market soon. FerndaleMarket.com.
All right, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about improving your health and quality of life. My name is Ken Hageland, and joining me today is Jetta Wiedemeyer Bauer. She is the manager of the volunteer and community outreach team at Trellis, a nonprofit that has been serving seniors and those who care for them for 28 years. And we are talking about the senior linkage line services they provide and really ways to access free, unbiased Medicare health insurance counseling, educational webinars on a variety of topics related to aging, just the important role of the volunteers in this. And we are currently in a very important period of time called the open Medicare enrollment period. Jetta, how can our listeners contact Trellis if they have more questions or want more information?
Right. We are the senior linkage line. So
Yep.
a couple ways. So 800-333-2433 is a Monday through Friday. It's an 8 to 4:30. It's not the crisis line, but it's the warm line that folks call in. Any question related on your mind to aging, give us a ring. Our website is trellisconnects.org. A lot of information there about everything related to, the things we've been talking about, but there's a tab on it called Get Help. That is where kind of my team works. Anything related to Medicare open enrollment, finding information about plans. If you wanted to attend a presentation, my team does education things out in the community. We also do them by Zoom. So you can find pieces on our website on that Get Help tab of the website.
Okay, yeah, and it's the first one on the top of the website. And there's several resources there listed. So I would encourage you. It's a beautiful website. It's easy to navigate. Nice and big letters and words and things. So I really encourage you folks, especially while we're talking, to pull up trellisconnects.org. And if you have any questions, you've got the person right here in the studio to answer those questions. So if you have a question for us right now, please give us a call, 952-946-6205, or text us at 612-999-3426. All right. Well, you talked about a number of amazing things. I had no idea the impact that Trellis and the senior linkage line were having on people just this last year. I mean, 1 million meals delivered, 22,000 rides. It's just, it's mind blowing.
Yeah.
I mean, and yet you're kind of a secret. I mean, you're affecting and impacting a lot of people, which is so great, and doing it just so wonderfully. And yet, again, I don't think a lot of people really understand the services that the senior linkage line from Trellis can actually do. Let's talk about, well, who calls the senior linkage line?
A lot of people call. We have individuals who are seniors themselves, or they're coming up on that age. They are soon to be retired, and they have this mystery of Medicare, and they want to unravel that. And so we just kind of open it up and unwrap that box, that present for them. We have seniors who are in their 70s and 80s, and they're calling on behalf of themselves. We have family members in their 20s and 30s calling on behalf of beloved aunties and grandparents and adult children calling. We have people who work for care facilities who give us a ring, and they want to, find the answer to something that's boggling them, or there's a confusion, or they're angry about something, and they have been mistreated, they think, by some entity, and they want to file an appeal, for instance. So a lot of people give us a ring. You don't have to be over 60 to give us a ring. That's kind of the misnomer of the piece of the senior linkage line. We will serve all that come to the table. But we provide a lot of resources statewide. People call and they want to know and have some education. We do presentations on how to prevent falls, how to learn more about healthcare directives, learn more about fraud and scam. 60 billion throughout the United States is wasted on fraud every year. So we do classes out in the community at libraries and community centers. We do them on Zoom. That was the COVID flavor of the month, right? But we still do it because some people have transportation issues, and we have some of the videos actually on our website when we have them translated into the American Sign Language, and some of them are in different languages, Spanish and such. So we're trying to get a bit greater access point for folks who may, English may not be their first language.
Right. Yeah. And it is, as you talk about access, people really do love the ability, and we've trained them all in now. I mean, everyone, if you haven't been trained in on how to do a Zoom call or a video presentation, call them and they'll help you with that because they help you with everything. But it's really interesting. I think there's in Minnesota alone, there's over 600,000 unpaid caregivers. So
Exactly.
it's phenomenal. We had the Department of Demographics here a while back, and it was just, again, shocking when you realize out of 5 million people, there's 600,000 that are out there helping people just unpaid. It's just family, friends, neighbors, and where did they get the information to help people? And we talked off the air. You have your employer give you your choices in your healthcare plan, right, for 40 years, 50 years, whatever your work life is, and all of a sudden you retire. Now you're confronted with over 100 options, and I know people struggle with 3 options.
Right.
How to sort through all the different versions and different benefits of each of those different things. So
it's just not even fair. You know what I mean? Because in
it's-
Minnesota, we've got 101 plans.
Wow.
And now, you might be in your 60s, 70s, 80s, and it's overwhelming,
Right.
And I always think that there's a continuum of people from very on one side of the continuum of people who they're just left brain. They love Medicare. They read those pieces, all of the details. They've got it. And then you go down the continuum to people who are like, I can do this. And then on the other end is kind of like people like me, like I can spell Medicare. Right. And so if you
Right.
happen to be on that continuum, we are an opportunity for you to ask some questions. I always say, ask me the question like I'm a kindergartner. Don't, I have no ego in it.
Right.
Just ask the question and we'll be able to kind of unravel. And we're going to ask a couple questions about, do you have a provider? Do you have a network that you want to stay in? Is there, company ABC that you like, that you need to be with? Do you travel? Do you spend your winters in a
That's
warm
true.
place?
Yeah.
Or do you like to stay here? Is there a network for pharmacy? We take all of this information, we put it in Medicare.gov. It's a kind of a tracking plan finder is what they call it. And we take 101 and bring it down to 5 or 6. And those 5 or 6 plans, then we start asking a little bit more questions. And the most important thing is that the senior linkage line is free, but it's also objective and neutral and unbiased. We are
Right.
not insurance agents. We cannot be. It's
Right.
by our policy. So I have no financial stake. I have no horse in the race of what you
Right.
choose. My goal, my staff's goal, is to make sure that people have the best healthcare that they can possibly afford. And some people say, well, I'll pay higher premiums, but I want the deductibles to be lower, or vice versa. Or I have macular degeneration. I've got to have this specialist.
Yeah.
Whatever plan gets me to this person or this, this company, I need to be with them. And so we kind of take their preferences into play, and we kind of put it in this magical buffet line. And then at the end of the day, they get to choose. Some people definitely are on fixed income and they cannot afford anything above X, Y, or Z. And so we'll, give them the options that fit their lifestyle. And others, they want to do a Medicare Advantage plan and they can afford that. So
Yeah, it's a lot of it's about wealth preservation too. How do you prevent your situation from becoming unbearable? So it's looking at all different categories. All right, it's time for a short break, folks. We'll be right back to continue our conversation with Jetta Wiedemeyer Bauer. She's the manager of the volunteer and community outreach team at Trellis, a nonprofit that has been serving seniors and those who care for them for 28 years. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Hagelin, and you're listening to Living Healthy and Aging Well.
You can't go through a day without hearing about healthcare reform. St. Paul Corner Drug is here to help you navigate the ever-changing healthcare landscape. We are your advocate in getting much-needed prescription medication covered under your insurance plan. Need to choose a different plan? There is no reason to feel like you are drowning in the system. St. Paul Corner Drug can make simple work out of finding you a plan that best suits your needs. You can rest assured at St. Paul Corner Drug, pharmacy the way it should be.
There really is no place like home. Hi, I'm Mary T. of Mary T. Home Health. When you're faced with an illness or an injury, being able to stay at home and receive care is important. Our home health offers a wide range of services, including skilled nursing, physical, occupational, and speech therapies, aides, homemakers, in-home respite care, and 24/7 live-in care. We'll work closely with your primary care provider to come up with an individualized plan for you. Learn more today at marytinc.com.
This is the Being Curious Show. I'm Brian Mariani, founder of No Shift Own.
And I'm Kelly Wagner, publisher of Edge Magazine. Our show is about curiously connecting teachers and seekers on a wide range of topics in a safe space.
And our intention is that these conversations spark your own curiosity that creates a life that totally lights you up.
We are on AM 950, Sundays at 2 p.m. and all podcast platforms. See you soon and stay curious.
Hi, this is Chad from AM 950. Snap Construction is arguably the most well-reviewed roofing, siding, window, and insulation contractor in the metro. Ryan is so excited about working with AM 950 and our listeners that he wants to help us grow.
This is Ryan, owner of Snap Construction. I was friends with Chad long before I started marketing with him. I was a bit skeptical of radio advertising before Chad convinced us to run ads. The advertising's been so successful, we want to help the station grow. We've absolutely loved working with the listeners of AM 950, and we all know how extremely important this radio station is to the community. To help AM 950 grow, Snap Construction will be putting up proceeds to assist the station in marketing on social media. Snap Construction encourages you to follow, engage, share, and interact on the AM 950 social media platforms. Together, we can all work to ensure AM 950 continues to thrive and grow in our communities. We stand by our work with a lifetime craftsmanship guarantee. For a free estimate or more information on our financing, call 612-333-SNAP or check us out online.
The Senior Linkage Line is a free statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
With a look at your AM 950 weather, I'm Patrick Lulia. Sunshine today with a high of 78, then tonight clear with a low of 59. Cafe Latte is unlike any restaurant you've ever experienced. Grab a tray and pick from their award-winning selections of soups, salads, sandwiches, and mouth-watering desserts. Cafe Latte, Victoria Street and Grand Avenue in St. Paul, or cafelatte.com.
Welcome back. You are listening to Living Healthy and Aging Well, where we talk about improving your health and quality of life. My name is Ken Haglund, and joining me today is Jetta Wiedemeyer Bauer. She is the manager of the volunteer and community outreach team at Trellis, a nonprofit that has been serving seniors and those who care for them for 28 years. And we are talking about the great services they provide through their Senior Linkage Line. And that is ways for people to access free, unbiased Medicare health insurance counseling and educational webinars on a variety of topics related to aging. And we're going to talk about this for the rest of the show. But I want to mention before we go on that this show is brought to you in part each week by the team at Minnesota Hospice. Minnesota Hospice is an independent, locally owned medical practice serving our Twin Cities communities with innovative and comprehensive end-of-life health care. The team at Minnesota Hospice has been providing patients and family members with award-winning end-of-life healthcare services. Hospice brings compassionate medical, social, emotional, and spiritual services to your home with no cost to you or your family. Please do not wait to learn how hospice care can benefit you and your loved ones. If you have any questions regarding the end-of-life care or support, please contact the caring team of experts at Minnesota Hospice. They are available to answer your questions 24 hours a day, 7 days a week. Their phone number is 952-898-1022. Once again, that number is 952-898-1022, or visit them online at minnesotahospice.com. trellisconnects.com. All right, let's continue our conversation with Jetta Wiedemeyer Bauer. She's the manager of the volunteer and community outreach team at Trellis, and she has been on the show before and is one of my favorite guests. She is so passionate about helping our seniors and those who care for them. Jetta, how can our listeners get a hold of Senior Linkage Line or your organization if they have more questions or want more information?
Yep. 1-800-333-2433 is the Monday through Friday, 8 to 4:30. Our website is trellisconnects.org. And if anyone wanted to email, it's just the word outreach at trellisconnects.org. That will get right to us.
Yeah, outreach at trellisconnects.org. Okay, fantastic. And if you have a question for us right now while Jetta's here in the studio, give us a call, 952-946-6205, or you can text us your question at 612-999-3426. All right. So, okay, let's talk about the Senior Linkage Line here. We want to keep focusing on that because it's so important this time of year. How does the Senior Linkage Line assist seniors on a one-on-one basis?
Right. Well, we take calls one-on-one on the Senior Linkage Line all the time. So, you'll have personalized care there. When we're talking about Medicare open enrollment, one of the secrets that we have is that we have one-on-one Medicare counseling appointments. If Medicare is that mystery that you want to talk about, we have an opportunity for folks to either meet on the phone one-on-one, or they can meet out in the community. We have 30 sites throughout the Twin Cities where people will schedule ahead of time from our website, trellisconnects.org. There's a tab called Get Help. And on the Get Help piece, you just, it's a tab for Medicare, and then it's appointments. And it says help with Medicare. So folks they just put your name in and your email and your phone, and then you set it up. And you might be going to a St. Paul location or a Hastings location, wherever folks live, and it's the most convenient for them. And so we just meet with folks out into the community a little bit more. Just one-on-one, right? And so you can make a phone appointment, you can make an in-person appointment. And so what it does is just sets it. And so as soon as you get that appointment, it sends you a text. So it's a reminder, and then it'll give you an email reminder. And then 24 hours in advance, it gives you another reminder. Folks typically show up and they just bring their Medicare card and they bring a list of their prescription drugs. And then again, we will work one-on-one with folks to kind of give them a sense of what might be good plans for them. And at the end of the day, the consumer gets to choose. So that's kind of the brand of service that we provide.
Yes, and just to remind people, we're focusing on the Twin Cities. That's where the radio station signal is. But again, throughout the state of Minnesota, there are other agencies or other locations that help serve them in those areas as well.
Absolutely. We are one of 6 area agencies on aging. The fun thing about us is that we are probably the biggest of the agencies. If you think about the state of Minnesota, 890,000 seniors over the age of 65,
That's
right?
right.
About 72% of them live in the Twin Cities. So it's our responsibility, it's our joy, it's our blessing to serve these folks. So we have a lot more resources just because there's a lot more people who are of the age of being served. Right. So a lot of the areas around the state don't have in-person Medicare counseling like we do. But the neat thing is that anyone in Elk River all the way up to International Falls, they could call for a phone appointment. And the first year we did this during COVID, it was a pilot, and more than half of the phone appointments were not from the Twin Cities. They were from Rochester and Duluth. So people were needing the service. So, and for us, Medicare open enrollment, it's like a national holiday, Ken. I mean, I think we should have cake, right? It's like a 7-week piece from October 15th to December 7th. And we in senior services, are just excited about it. And one of the things I'm really excited about is we have, for the first time, we've never done this before. The Senior Linkage Line has never stepped out this way boldly, but we are excited that we have an event on November 5th. It's a Saturday. It's called Let's Talk Medicare. And we are going to be at a church in North Minneapolis called Fellowship Missionary Baptist Church. It is a beautiful, vibrant church on the north side. We are going to have just some conversation about Medicare. We're going to kind of break down some of the myths. We're going to have a panel of community folks that have participated and been recipients of the Senior Linkage Line, or they've worked for agencies and they've referred folks to the Senior Linkage Line. But the key is we're going to cater cater lunch. I am working with Miss Crystal, and she is a member of that church, and she runs a catering company called Joyful Temptation Southern Cooking. And I think of that name, and I've just gained like 3 pounds. And so, we're at that place where people are a little bit more comfortable with COVID. They're willing to come out and experience. You can wear a mask. You don't have to wear a mask, whatever you're comfortable with.
Yeah.
But we're going to have this cool conversation, and it's going to be the MC is Shaletta Brundlich. She is a really popular radio personality in Twin Cities. She's a comedian. So there's not a conversation you have with Shaletta that's not hysterical. But our hope is to let people come to the table, have a little fellowship, have a little fun, have a little food. And then if you've got those questions regarding Medicare, I'm going to bring my team. I've got a number of my volunteers who are Medicare counselors. They've been doing this for 5 to 10 years, and like they're better than me. They can do more than just spelling Medicare, right? They know the alphabet soup of A, B, C, and D. And so we're going to have lunch. We're going to have conversations. In fact, we're going to do some raffles for gift cards for folks if people are interested. We just think that people need to come to the table and experience what the Senior Linkage Line has to offer. And what happens, Ken, is people don't compare their plans. A lot of people, probably middle income to high income people, they know how to compare plans. They know how to get the resources out there. But some of our lower income populations, communities of color, they don't, and they don't know why. And either they don't trust government. They're like, you know what? My sister had this plan, and I got the plan. It's a family deal. And one person may have issues related to diabetes, and the other one is completely healthy, or they have things related to hearing loss. Completely different people, completely different plans. And so our hope is to get them to the table and say, okay, these are the plans that are probably good for you. These are the premiums, the deductible, the coverage areas, all of the cost plans. And we can take these incredibly complicated pieces and boil it down. And then at the end of the day, we'll have our cake.
Yeah, right.
It's all about cake, Ken.
No, well, anything with food, you're going to get people. But this is just so important. There's of the 2 fears that people have at after retirement. It's money issues and it's healthcare.
Yeah.
And this is something that people just shouldn't take for granted. They shouldn't avoid investing the time. And what a great service here.
Yeah.
You've got all these wonderfully trained people. And again, to have it done by volunteers is just so special.
Yeah.
Because these people want to help other people, and they're so committed to that.
Yeah.
And so I encourage people, you just have to go to the website, schedule an appointment for either in person or by phone. And again, you don't have to be a senior to do this. So the adult children,
right?
Anybody that's taking care of a senior can benefit from this as well, and they can be on the line as well.
Yeah.
If the senior, I guess, authorizes that or was okay with that.
Yeah, they'll have do you confirm, and we do confidentiality statements.
Yes.
It's really this time of year, you can't get past your television or any ads in the mail, and you have all these individuals who are celebrities back in the day in the 60s, 70s, and 80s and 90s. And you're like, wow, they can throw a football. They're a professional, they don't know anything about Medicare. They are paid to read a script. If you really, want to go that way, that's your choice.
Right.
But we're offering another opportunity it's free, but it's also unbiased and it's neutral. And our goal is to have families make good choices, not to funnel you into a specific plan that this celebrity is pitching. They're the pitch guide for it. So,
right.
But you mentioned volunteers, and I wanted to kind of touch on that. Trellis has the blessing of being able to work with about 90 volunteers.
Wow.
They do incredible things for us. I mean, not only do we have 30 volunteers that know Medicare inside and out, but we have volunteers that do public speaking. We have volunteers at community events, like libraries will have open houses or community health fairs up in different parts in the cities, and they will go and they'll talk a little bit about Trellis and the Senior Linkage Line and just educate folks of the best kept secret in the Twin Cities. Right? They come with us. They do media. I'm talking to someone today. A little bit later, she wants to be a photographer, and she doesn't know anything about Medicare. She doesn't like to public speak. She's quiet behind a camera, and I'm like, oh, we so need that.
Right.
And some of our volunteers, they're in their 20s, and we have volunteers. My buddy John, he's like, I'm an octogenarian. I'm like, I will look that up. Oh, you're 80. Yes, that's what that means, John. And he doesn't want to have his brain fall apart. He always wants to stay sharp. He always wants to learn something new. So some people in their career were doing things related to Medicare and health insurance and in HR, and they want to continue to do that. And there's other people who had no interest in that, and they want to try something completely
Right.
new.
Right.
So they can give us a ring. And if, on our website, there's a tab called Volunteer at the top, and it has information about what we do and how we do it. Folks can certainly tab up to that. There's an application in English, but also one in Spanish. We are over the last couple years, we've been recruiting folks who have language skills, right? Because a lot of our listeners are in English, but a lot of folks, there's a barrier. They can't access services. They don't know how to tap into these free services for the state. So we've been recruiting, I think last year, half of our volunteers were folks who spoke English and another language, or they didn't speak English at all. So
Wow.
I've hired our staff 2 years ago spoke only English, and now we have 6 languages that we work with. But we also recruit volunteers that speak languages that we don't speak, so that we can reach. I mean, I was at the Corinne organization, Minnesota. I'd never heard of this organization. They had never heard of us, but through translation, we gave them more information so that they can make good choices.
Wow.
So the Senior
That
Linkage
is
Line has a lot of
fantastic.
opportunity to reach people's lives. So
Yeah.
if people can join us on November 5th, the Fellowship
Right.
Missionary, you just go to the website, trellisconnects.org, and you just /updates, and that's how you find the information.
All right. Fantastic. All right. It's time for a short break, folks. We'll be right back to continue our conversation with Jetta Wiedemeyer Bauer. She is the manager of the volunteer and community outreach team at Trellis, a nonprofit that's been serving seniors and those who care for them for 28 years. And we've been talking about the Senior Linkage Line services, and we'll continue to do that in our last segment. So if you have a question for us, give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Haglund, and you are listening to Living Healthy and Aging Well.
SeniorCommunities.guide is your free online website to find housing, care, and resources for seniors in Minnesota. Use the powerful, award-winning search tool to quickly improve your search. You will have all the information you need to contact providers directly without any hassle. Start your search now at SeniorCommunities.guide and follow us on Facebook for interesting articles, helpful advice, and how older adults are changing the world.
SeniorCommunities.guide.
Hi, I'm Mary T. of the Mary T. family of companies. Our new Camellia Rose Assisted Living and Memory Care is a bold reimagining of what assisted living can be. Our emphasis is on creative meals, outdoor walking paths, and a spectrum of restorative therapies and activities. We are founded on a history of care. We are dedicated to enriching lives. Learn more about Camellia Rose Assisted Living and Memory Care by visiting marytinc.com.
Now, more than ever, we are being faced daily with the topic of human mortality. And for many people, estate planning has been top of mind. Getting your estate planning done now can be easy and cost effective. Schroman Law offers virtual options for initial consultations so that new clients can safely initiate the process. With many facing uncertain financial situations, Schroman Law also offers affordable fees for legal documents. Learn more at schromanlaw.com. That's SCHROMEN law.com.
Minnesotans age 65 plus might qualify for Health Partners Minnesota Senior Health Options. The plan includes personal support, coverage for medical, prescription drugs, and dental, plus over 30 extra benefits. Eligibility information is available at healthpartners.com/oneplan. Health Partners is a health plan that contracts with both Medicare and the Minnesota Medical Assistance Medicaid program to provide benefits of both programs to enrollees. Enrollment in Health Partners depends on contract renewal.
How have you been sleeping? I'm Dr. Inel Rosario from Andrus ENT and Sleep Center, an independently owned clinic helping Minnesotans live and sleep better. We are experts at treating ear, nose, and throat issues and are equipped with an audiology and sleep center. Take the first steps to a better night's sleep and better health. Online at andrusent-sleep.com. That's andrusent-sleep.com. Or call 651-888-7800.
We use technology every day to help manage our lives. Why not use it to help manage your medications? St. Paul Corner Drug offers several free tools to keep you on track while taking your medications. Use our mobile app to quickly order a refill, or the Meds on Q application, which turns your smartphone or tablet into your very own personal medication attendant. Email and text messaging options let you know when your medication is ready for pickup, making efficient use of your time. St. Paul Corner Drug, pharmacy the way it should be.
right, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about improving your health and quality of life. My name is Ken Haglund, and joining me today is Jetta Wiedemeyer Bauer. She is a great friend of the show. We are so excited to have her here. She is the manager of the volunteer and community outreach team at Trellis, a nonprofit that's been serving seniors and those who care for them for 28 years. And we are talking about the wonderful senior linkage line services that they provide to all seniors and those who care for seniors. And specifically, some of the things that they provide is free, unbiased Medicare health insurance counseling, which is very important right now because we're in the open enrollment period. That only happens once a year. And so if you have any questions on that, be sure and contact the Senior Linkage Line. Also, a variety of educational webinars on topics related to aging. They have amazing volunteers that work there. And if you're interested in being a volunteer, you need to reach out and contact Jetta on that. And with that, Jetta, how do listeners get a hold of you guys for questions or want more information? What are the best ways to do that?
Yep. Folks call the Senior Linkage Line directly Monday through Friday, 8 to 4:30. It's 800-333-2433. A lot of people access us on our website, trellisconnects.org.
Very easy website to navigate, folks. Very well laid out. Very, very nice looking. So if you have a question for Jetta, we are in the last segment of the show. So please give us a call, 952-946-6205, or you can text us your question at 612-999-3426. Okay, so leading up to the show, I was getting texts from people knowing that you're going to be on. We were promoting you throughout the week, and a lot of the questions were about changes. Are there any significant changes this year? Is what the common theme was.
Right.
And so maybe we should look at, I know you've been in several training sessions with all these things. There are changes this year, and maybe we talk a bit about those in the last segment.
There are significant changes. By comparison, last year when we went through this, my staff, we had no trainings. There was very little, I think one or two changes. This year we were in training after training, and the slide deck is large. What we know is that there's a lot of things coming down the pike. People who have, whether it's a Medicare Advantage plan or they have original Medicare A and B, and maybe they add D, it's important to realize that things change every year. And it's important to not assume that what you had last year, like right now, is going to be the same on January 1st. People really get into that mistake because your premiums are going to change. Your deductibles could change. Your entire network plan. They could move the physical network of the plan, or they could move the providers in the plan. They come off, they come on. Your pharmacist, your doctor, your physician's assistants, whoever you love. And, we get attached to people. We want
especially
those
the
folks.
therapists.
Exactly. And so those specialty pieces, they're going to change, or they have potential to change. Prescription drugs. And so we have formularies and there's restrictions on drugs. But what we found out this year is that the Inflation Reduction Act that passed in the fall, there's a lot of changes that are happening there, right? We have decreases in drug costs for people on Medicare Part D, which is incredible. I mean, when have we ever had those things change? So that was fabulous.
Yeah.
When we're talking about Part D insulin for folks on certain plans, capping at $35, that is a life changer.
Yeah.
Right.
That was hundreds of dollars.
Hundreds of dollars. We have $0 for adult vaccines for anyone on their Part D plans.
Okay.
We've got changes federally. There's been extended coverage for folks who have like kidney transplants and renal. They have immunosuppressive drugs, end of stage renal disease drugs that are going to be covered, or they're extending those coverage. I think for us, when we talk about the pandemic, there's expanding coverage for mental health services through telehealth. There's incredible things that are shifting, and folks aren't really aware of it. In fact, we're studying every day about the new changes and the new plans, and how it's like a shifting sand amongst our feet. So if us in the expert lane of Medicare are having troubles, we can only imagine what our parents and our friends and our grandparents are going through. So it's really important to cost compare, to look at it. And at the end of the day, you may have plan ABC and we give you the information, or you do your own research other places through other trusted sources, and you may continue to pick the same plan, but we may be able to help you understand things about the deductibles and the premiums and the co-pays and the cost sharing types of things to make some realities, because we have until December 7th to set that plan. And then as of January 1, it goes into effect. And unless you go into some other special enrollment period. They call them SEPs because we like acronyms in government. Special enrollment plan periods. Unless something like that changes, you don't have the ability to make a shift. So, we just know that there are changes afoot, and some of them are really good changes.
Right,
for
you
families.
mentioned some of those.
Holy buckets!
Yeah.
I mean, the premiums going down and things related to insulin. There's a guy that we worked with. His name is Peter, and he was taking some drugs, and his lifestyle was that his medications were about $500 a month.
Wow.
$500 a month. He had some insulin-related diabetes. He had kidney things. He couldn't afford it. And so he reached out, and working with one of our specialists, they realized he was low enough income, he had low enough assets, and they put him on some extra help subsidy programs that he had no idea that they were available. And as a result of his, a little bit of time with us, $500 a month. And you know what he was doing? He wasn't taking all of his medication.
That's right.
He was doing it every other day, every other week,
Right,
and
to
he was
stretch it.
he
Yeah.
was stretching it. So we applied him on a full subsidy extra help grant for him. He pays $130. $130, and he was paying
Wow.
$500. And his entire life has changed, and he's able to find, like I always say, we try to optimize well-being as people live and get older.
Right.
Peter now has a different outlook on life, and we are just one entity, one service, and if we were able to help that one person, not everyone is going to be a Peter,
Mhm.
but we have an opportunity to say, if you trust us and just anonymously talk about your income, talk about your assets, give us a little of information, we might be able to uncover some programs that they are available to you too. So we always say, just ask,
Yeah.
find the courage for 20 seconds to ask
Right.
that question, and we'll see what we can do to answer those questions.
Right. And again, it's free, it's unbiased. Again, I forgot about that. You guys are thinking about other resources to
Mhm.
help pay for the
Absolutely.
Medicare program.
And that's the networking of the Senior Linkage Line. We work with a lot of
Right.
different programs, federal, state, county programs. So,
Yeah.
I know we talked about last segment about the
Yeah.
Let's Talk Medicare. If folks are at least hesitant, come and join us. Have a
Yeah.
free meal. Enjoy us, in real time. It will take the scary out of Medicare and allow people to ask those questions. So it's a Fellowship Missionary Baptist Church. It's November 5th. It's 10:30 to noon. Free meal. A little bit like Shaletta's a comedian. She's going to be
Yes,
funny,
she
right?
will be fun.
But our opportunity is to meet one-on-one with folks and kind of take the anxiety out of what's going on. But if they go to trellisconnects.org and click on the, updates, and at the top of the page, it's Let's Talk Medicare with Shaletta.
All right. Well, we are at the end of the show, folks. I am so grateful to have Jetta Wiedemeyer-Bauer here to help us navigate through this amazing time of open enrollment. She's the manager of the volunteer and community outreach team at Trellis, a nonprofit that's been serving seniors and those who care for them for 28 years. And we've been talking about the Senior Linkage Line services. Jetta, one more time, if they want to get a hold of you or your team, how do they do that?
800-333-2433 or trellisconnects.org.
Excellent. All right. We hope you enjoyed today's show, folks. Please contact us with any questions or comments you have regarding today's conversation. You can reach us anytime by voice or text at 612-999-3426. Thank you for listening to Living Healthy and Aging Well, where we talk about your health and your life. Until next time, choose to live well.
No matter if you're eating out or cooking something at home, eatlocalminnesota.com has you covered with a list of locally owned restaurants and food purveyors. Locally owned Vinaigrette has been offering the finest olive oil and vinegar since 2009. Reintroduce yourself to all the many flavors by tasting before you buy. From darker white balsamic to cold pressed extra virgin olive oil from all over the world, there is something for everyone. Vinaigrette, located at 50th and Xerxes in Minneapolis, or at vinaigrettemn.com. The Park Tavern is your go-to destination for fun. Enjoy the fantastic food like their pizzas, burgers, and sandwiches, the best bowling in Minnesota, their wildly popular outdoor patio, great drink specials, all the big games on their numerous screens, and it's the perfect place for your next private event, even large gatherings for over 200. The Park Tavern is your go-to destination for everyone. Have fun at the Park Tavern, Louisiana Avenue, north of Highway 7 in St. Louis Park.
Come on, you know it's true. Work is almost bearable when the Stephanie Miller Show is on. AM 950 KTNF, St. Louis Park, Minneapolis.